Yes, so now it should work. So my name is Sanne. I'm a PhD student at Maastricht University and at the Catholic University in Leuven. And my research project aims to examine the susceptibility to false memories after performing eye movements as used in EMDR. So I also focused on suggestive false memories, but for today I will only discuss a study related to spontaneous false memories. So to provide you a bit of a background, back in the 90s, we had the most heated debate known in psychology, which is known as the recovered memory debate or the memory wars, that surrounded the concept of repression, and that showed that clinicians still had strong beliefs in the concept of repression, while memory researchers claimed to have no scientific evidence for this, and that traumatic memories were actually quite well remembered. Now, around that same time, a few years earlier, EMDR was actually developed. It was developed by Shapiro by accident, so to say, and I think the most known component that most of you all also know is that patients are asked to perform eye movements. So this central part of EMDR is that a patient is asked to perform eye movements. So a therapist will induce that by means of moving the index finger horizontally in front of the patient's visual field. And at the same time, the patient has to recall the most traumatic part of the traumatic event that he or she has witnessed. And despite not knowing how it actually works, EMDR was applied in practice with PTSD patients, and it showed actually quite fast recovery in these patients. So over the years, EMDR has gained immense popularity. A lot of studies were conducted to examine the working mechanism behind it. And nowadays, the working hypothesis is the most accepted explanation of this effect. It namely states that performing this task simultaneously, so and memory recall and performing the eye movements, will lead to the taxing of the working memory, and therefore the vividness and emotionality of the traumatic memory will decline. Nowadays, actually, EMDR is also applied to other disorders than PTSD alone. It's also treated for depression, for eating disorders, etc. While actually for PTSD, there's still not enough knowledge about how it works, why it works, and what the long-term effects are. This popularity of EMDR was actually also visible in legal cases in the Netherlands. So we not only saw that EMDR was mentioned more often in these legal cases, but what was more striking was that in some cases, it actually reminded expert witnesses back to the memory wars debate in the beginning of the 90s. So in some cases, it was the case that therapists provided information, so that would be providing misinformation, but in others, it was also evident that after EMDR, new memories popped up. So the central question here was if eye movements as used in EMDR could lead to spontaneous false memories. So in our study, we used the DRM paradigm as well, as the same paradigm as Lily just explained. So we used neutral and negative word lists. So we have a neutral list of butter, yeast, baker, etc., which are related to the word bread, and a negative word list related to the word murder. Hereafter, our participants were randomly assigned to either an eye movement condition or a control condition. And in the eye movement condition, we asked participants to perform eye movements. And to do this, let's see if it will work. We used the EMDR kit. This is actually used in practice because normally a therapist would induce the eye movements with their fingers, and to prevent the physical activation of this, they use the EMDR kit. So we'll just show you a few seconds of how this actually looks like if you're having a patient sitting in front of you.
Each of your clients with visual, oral,
So that is actually what we use. As you can see, there's also tactile and audio taxing possible, but we only use the EMDR kit, so the light bulb. And during performing the eye movements or not, participants were asked to freely recall as many words as they could remember. And after that, we gave them a recognition task where they could say yes, no, or I don't know. Then we conducted a second experiment, which is actually the same procedure, but only the memory tests were 48 hours later. And this was done to ensure a reconsolidation phase to see if there were actually any lasting memory effects. So when we did everything in one session, so our first experiment, we didn't find any differences, significant differences between the eye movement and the control group. But when memory was tested 48 hours later, we found that participants who performed the eye movements had more correct answer, as both on the free recall and the recognition task, but they also had more false memories. And more specifically, if we look into the different valence as well, for the true recall, we saw an increase in neutral true memories, which is quite interesting because eye movements only tend to influence balanced memories. So positive memories after performing eye movements become less positive, and negative memories become less negative after performing eye movements. Eye movements shouldn't influence neutral memories. So it's interesting to see that this, that the eye movement participants here have an increase in their neutral true memories. When we look at false memories, we see an overall condition effect in both negative and neutral words that participants who performed eye movements freely recalled and recognized more false memories than our control group. So when we look at the theoretical framework behind this, and then I'm talking about the association activation theory, the AAT, logically to follow, because the more words an individual remembers, the more likely it is that the critical word, in this case murder, will also be falsely remembered. So consequences of this is, of course, that this might be a side effect of the EMDR therapy itself. So even if a therapist would refrain from suggestive questioning or whatever, still, the eye movement component might cause some side effects. Of course, EMDR is much more than just the eye movements. There are 8 phases in total, but still it's an important one because this is the active part where a therapist will work with the autobiographical memory of the patient. But it can also lead to legal consequences and lead to miscarriages of justice. On one hand, it can make a testimony less accurate, or a testimony can include wrong details, which can lead to a wrongful prosecution, and eventually, if that even continues, a wrongful conviction. And my questions to you actually were more practically related. Well, of course, first I wanted to know maybe some other paradigms to examine this, because what I think you can imagine is a lot of the criticism that I get from clinicians is that it's just worthless and it's nothing comparable to a real life trauma. But also what I really wanted to know is how you think about making it clear to psychologists that they should be aware of the consequences, because normally they just say, well, I'm not doing a fact-finding process, I'm a therapist and I just work with the client. But even when a patient doesn't decide to file a lawsuit, but still talks about it in his or her family, it can lead to having no contact with the father or the mother or whatever. So it still has consequences either way. And I just wanted to hear your thoughts about how to communicate this or make clear to clinicians that it's really something they should be aware of.
Great, thank you very much. There's a question that's popped up in the chat. Very nicely done, Sanne, I enjoyed that. The question is, EM and EMDR played a role to maintain dual attention. one to the target, the trauma memory, the other one to the movement to ensure the client is in the here and now simultaneously while connected to the target memory in the past. In your experiment, did you instruct them to follow the lines, the eye movement, while at the same time trying to imagine the DRM words in their mind, or just to do the eye movement?
Yeah, so thank you for the question, Nael. So what we instructed the participants is, of course, well, just the same instruction that patients would get in EMDR, so that they have to follow it with their eyes only, keep their head still, and also if we see that they stopped following it, that we kept saying, try to focus, follow the light bulb. Of course, in EMDR, it's really important how a patient looks at or experiences the trauma at here and now, at present. So we also emphasize that they should only mention words that they could remember here and now, and really just think about it.
Great, thank you. Do you want to put your questions back up?
Yes.
Anna? Ah, great. Other interesting paradigms to examine spontaneous false memories. Anybody have any suggestions? It's an interesting one. It makes me think about a lot of the motivation behind Beth Loftus's work to try some rather unique paradigms to see if she could induce more real-worldy kind of false memories, like with the Pluto studies and Warner Brothers characters, seeing if she could get people to confuse the two. Or I think of like Rob Nash and some of his work with Melanie Takarangi and alcohol blackouts and false memories. So trying to retrospectively ask people about it. Anyone else?
If I may, I can suggest one thing. Sanne, a great presentation. I was wondering, when are you going to start the effect of MDR while suggestively interviewing your participants? Because I wonder, and perhaps I even imagine that during this therapy, if some therapist suggestively induce something that actually hasn't happened, how these people are going to react while being kind of hypnotized, let's say. Okay, yeah. I shouldn't say that, but you got it. Thanks.
Yeah, so I conducted a study that's more in line of the suggestive false memories, but then it's not that we suggested a complete event during the eye movement. So that was actually also with the traumatic film paradigm that was used in a previous presentation today. And there we see that eye movements degrade the initial memory for the event. And when you provide them with misinformation, that they incorporate that in their own memory. So they fill the gaps with this misinformation. But on the other hand, there were also replication studies who didn't find this. So it would be really interesting to see indeed, because now the misinformation came from a so-called eyewitness, but it would be interesting to see when this misinformation comes for a more authority figure, like a therapist or like the experimenter.
Great, Sonnet. John Child, did you want to ask a question?
Yeah, I was just going to ask briefly. Hi, thanks. Again, really interesting talk. I just wondered at the end why you focus the critique on the psychologists themselves. So when thinking about the legal consequences of this information, why is it that you think that the psychologist has some kind of duty towards truth-telling in court, as opposed to simply thinking about the admissibility of that evidence? From, like, as in the expert critique that you would have in a courtroom. It seems quite unique almost to put that responsibility on a third party in that way. I just wondered why that was your focus.
Yeah, so it's not necessarily the truth telling in court, but what we usually see, what I also had, so okay. In another study, what I found was that a lot of EMDR therapists still believe in the concept of repression. And I think if someone works with autobiographical memories, you have to expect from your therapist that he or she knows how memory operates and knows how vulnerable memory is, and it's open to suggestion, and that it's a reconstructive process. So that you have to be careful with suggestive questioning, or that patient can make associations, so that if new memories pop up during the therapy, that you should rather say, okay, we'll just park this memory aside and we will just continue with what we did already know before therapy, and then continue with that. And it's more that I think it's also kind of a therapeutic responsibility towards your client, to provide them with correct information. That it might be the case that new memories pop up, and it might also be the case that these are false memories. So I think it's more that they have to become aware of that it's also their responsibility, and not just think, well, I'm just working in the room and what stays in this room will stay here, because it can have far-stretched consequences.
Thank you. Sanne, there's some interesting questions that are kind of related to the discussion happening now that have popped up in the chat. Amina, did you want to talk a bit of vulnerability?
Yeah, it's just in relation to the question. Thank you for your talk, by the way. As to how we should make it clear to psychologists what they should be aware of in terms of the consequences. It kind of really depends. I think the most important message is that some people are going to be more vulnerable than others. We already know that from our research on suggestibility. So I think that's sort of a more important question to be sort of asking, as well as, you know, the obvious questions that you've already discussed regarding ecological validity and what results you'd have if you worked with more threatening, personally engaging and threatening scenarios, and what kind of effects you'd get over time. EMDR is used quite a lot for the treatment of severe trauma, so this is an important area of research. Thank you.
Thank you.
There's some additional points being raised. So how prevalent is EMDR in therapy, and what is the theory behind it? Why would moving the eyes make one more or less suggestible?
Yeah, well, if we're really talking about suggestible, so prevalence EMDR is highly prevalent. It's really a first choice to treat PTSD. So I would definitely say that 9 out of 10 therapists will choose for EMDR to treat PTSD. Our reasoning was, but that's then for the suggestive false memories, that doesn't pertain really to the DRM study here, is that you have an authentic memory of something, or your initial memory. Eye movements will make it, following the working memory theory, will make this memory less vivid, less emotional, so it becomes more vague. You don't know the exact details anymore, and thereby the misinformation. So if someone suggests something to you, then it will make you more likely to accept it, because your memory is already vague, and then you will just complete the gaps to come up with a coherent story again. Let's see if that was
Is it used in the UK?
Yeah, so Amina indeed says in the UK it's used by clinicians working in the National Health Services as treatment for severe trauma. Yeah.
Any further questions? All right. Thank you very much, Sanne. That was a great talk. The